Marley Drug.
Hi, my name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. Today we're going to discuss a prescription medication that has been on the market for several decades called Spironolactone, also known as Aldactone, used to treat various types of medical conditions. Let's first discuss what this medication is used for and how it can benefit you. Initially, Spironolactone was primarily used as a potassium-sparing diuretic, also referred to as a water pill, to treat conditions such as edema or swelling that is caused by too much fluid, or heart failure, hypertension, or high blood pressure. However, over the years, its uses have expanded beyond its diuretic properties. Spironolactone may also be used for swelling due to liver and kidney problems or having too much aldosterone. Aldosterone plays an important role in regulating sodium and potassium levels in your body. Those affected with primary hyperaldosteronism experience an excess of aldosterone, resulting in elevated sodium levels and decreased potassium levels. This imbalance can lead to hypertension, irregular heart rhythms, and muscle weakness. So, in addition to its diuretic effects, Spironolactone is also used off-label for various conditions, including hirsutism, which is excess hair growth, and acne. Some studies even show that Spironolactone can be an effective treatment option for female pattern hair loss. While these uses are common in clinical practice, they are not specifically FDA-approved indications. Now that we know more about what Spironolactone can be used for, let's discuss how it works. Spironolactone works by blocking the action of aldosterone, which is a hormone responsible for regulating sodium and potassium levels in your body. So by inhibiting aldosterone's effects, Spironolactone helps to retain potassium while promoting the excretion of sodium and water. This action reduces fluid retention and lowers blood pressure, making Spironolactone effective in treating conditions such as hypertension, edema, and heart failure. Additionally, Spironolactone has effects that also make it effective in treating conditions such as hirsutism and acne. Spironolactone is available in tablet form in 25, 50, and 100 milligrams and can be taken by mouth with or without food. Spironolactone is also offered in oral suspension form known as Spir. However, it is important to understand that the tablets of Spironolactone known as Aldactone and the oral suspension of Spironolactone known as Spir are not the same and cannot be interchanged or substituted for each other. If you are using the oral suspension, it is recommended to store the medication at room temperature and thoroughly shake the bottle before each use. It is recommended to use a dosing cup or syringe provided by your pharmacy for accurate measurement of doses. Avoid using household kitchen or measuring spoons as they may lead to inaccurate dosing. If you do forget to take a dose, take it as soon as you remember. However, if it's almost time for your next scheduled dose, it's best to skip the missed dose and continue with your regular dosing schedule. It is, however, important to avoid doubling doses to make up for the missed one. Now let's switch to some precautions you should take and some side effects you should be aware of while taking this medication. If you are currently pregnant or considering becoming pregnant, it is important to discuss this with your healthcare provider before starting Spironolactone treatment. This medication is not recommended for use during pregnancy due to limited research indicating potential harm to the developing fetus. And depending on your health circumstances, your healthcare provider can discuss alternative, safer treatment options with you. And like all medications, Spironolactone has a few side effects. Some common side effects may include increased urination, which may lead to dehydration, low blood pressure, or even kidney problems, dizziness, fatigue, nausea, vomiting, headache, diarrhea, or enlargement of male breasts or breast pain or swelling in males and females, or decreased sex drive, sexual dysfunction, irregular or lack of menstrual periods, increased potassium levels, decreased sodium levels. If you are experiencing any of these side effects, be sure to talk with your healthcare provider to determine whether a dose adjustment or switching to a different medication would be beneficial for you. Spironolactone may also cause some serious side effects. Some serious side effects of this medication that you should be aware of include having a lightheaded feeling like you may pass out, having high levels of potassium. Signs and symptoms of this may include nausea, muscle weakness, tingling sensation, chest pain, difficulty breathing, irregular heartbeats, and/or loss of movement. Signs of other electrolyte imbalances including increased thirst or urination, confusion, vomiting, muscle pain, slurred speech, severe weakness, numbness, loss of coordination, and feeling unsteady. Signs of kidney failure including decreased urination, muscle cramps, nausea, vomiting, tiredness, or swelling, or severe skin reactions such as sore throat, fever, tiredness, difficulty swallowing, stinging sensation in the eyes, body aches, rash, itchiness, or peeling or blistering of your skin, or signs of an allergic reaction such as having difficulty breathing or swallowing, experiencing swelling on your face, lips, mouth, or throat, peeling skin, rash, or hives. If you are experiencing any of these serious side effects, immediately call your doctor and stop taking this medication. Keep in mind that spironolactone may interact with certain medications or supplements and may not work as well when you use other medications at the same time. Using potassium supplements or salt substitutes containing potassium while on spironolactone can result in elevated potassium levels in your bloodstream, potentially leading to heart complications. These are recommended to be avoided unless instructed to do so by your healthcare provider. It is recommended to avoid using spironolactone with medications that could increase your risk of certain side effects, including heart medications such as digoxin, mood stabilizers such as lithium, or non-steroidal anti-inflammatory drugs or NSAIDs such as ibuprofen or aspirin. To briefly summarize what we discussed today, spironolactone is a prescription medication available for decades, also known as Aldactone, is often used to treat various medical conditions. Initially, it served as a potassium-sparing diuretic to address conditions such as edema, heart failure, and hypertension. However, its use has expanded over time, including treatments for liver and kidney-related swelling and excessive aldosterone. Spironolactone works by blocking aldosterone's actions, promoting potassium retention while excreting sodium and water, thereby lowering blood pressure and reducing fluid retention. And regarding precautions, it is important to speak with your healthcare provider before starting treatment, especially if you are pregnant or considering becoming pregnant, due to potential fetal harm. You can read more about heart failure, hypertension, edema, and various health conditions on our website, so check those articles out in the links below. And if you have any questions, be sure to talk to your doctor or leave them in the comment sections below. And don't forget to subscribe. Bye for now.